The University of Texas Houston is located at the Texas Medical Center area. It is an academic teaching institution, and our primary focus is to educate and to do groundbreaking research and also to provide excellent clinical care. When I saw this at the AHRA website about putting patients first program, I was really intrigued and interested in reading more about the program because it talked about a focus of patient care, and which is very important vision for our institution.
We are extremely grateful and feel blessed about getting a grant from AHRA and Canon to help translate our dreams into reality. Patient anxiety is paramount when they come in for one of these procedures because they're worried about a needle placement in them. And we have changed their anxiety levels by creating websites through the AHRA Canon grant to educate our patients. And this can go into the form of cell phones, into tablets, and also when they go back home, they can again review what is happening to help them relate to it. And if they ever come back again, this is another way for them to understand it.
When the patients go into this website, it is an educational resource location where they're able to go in and look at the physicians who's going to be performing their procedure, read up about the physician, and also there's educational information about the actual procedure that they're going to have and video links to what procedure they're going to perform. So in that way, if they have any questions, they can address it with the physician before the actual procedure begins.
Thanks to the AHRA and Canon again for providing us with this grant, because this would help us further develop the website that we have by adding on other components of imaging and image-guided procedures that we're planning to expand it into.
My name is Amit Sura, and I'm a pediatric radiologist at a local children's hospital in Los Angeles. So my focus is pediatric radiology. I work at a standalone children's hospital, reading everything from head to toe regarding any pediatric pathology or disease process. The idea primarily came from the fact that I had that hypothesis that we were performing way too many of these MRCPs in settings where an ultrasound actually would be able to tell us enough information. Whenever any child has to go through any MRI procedure, it creates a level of anxiety, it creates an additional longer stay in a hospital for both the patient and the family, which can be very distressing. Sometimes it requires general anesthesia, which is also very nerve-wracking for families. And so if we can kind of reduce some of those components, I feel like, it's a win-win situation for everybody involved. Oh, definitely. I feel like I will continue to work with the AHRA and Canon to, again, place, patient safety and care at the forefront, and work to really streamline processes and quality initiatives in which the patient benefits first.
Massachusetts General Hospital has a children's hospital within it. We have 2 inpatient units, a pediatric ICU and a neonatal ICU. We also have a variety of subspecialties that treat pediatric patients.
I first learned about the Putting Patients First program through the AHRA website. I was extremely excited, thinking that it may be a way for us to further some educational efforts regarding pediatric patient experience and just quality improvement in that area for us.
We chose to focus our program on the VR software simulation program because we felt that it would provide our patients with the opportunity to practice their MRI scan prior to having it. It provides them with a very realistic opportunity to practice laying down in the scanner. It gives them the experience of having a head coil over them, so they'll see what it looks like. They also have the opportunity to hear the noise or the sounds that the scanner will make. And most importantly, it helps them to hold very still and practice that aspect of the MRI.
So far, the reaction has been very positive. As we tell patients about the program, both kids and their parents seem really excited about the possibility of the VR. We've also had some piloting of the VR video content to both radiologists and to pediatricians, and they've all been very excited, and they think that it's something that should really improve our MRI practice a lot.